for being here, Dr. Hoffman. 50% of Americans are taking vitamins. It's become like a huge business. Somewhere between $15 billion to $20 billion a year is going into this. And since 1970, the amount of consumption of vitamins has gone up, almost doubled and tripled. And I talk to my patients, they come in now with bottles after bottles of these vitamins saying like, doc, is this gonna keep me healthier? I have my own personal bias, and I use the word bias because I never really studied these. This is not my field. I'm a surgeon, a urologic surgeon for prostate cancer. So I don't certainly claim that I know a lot about this, but I'm a huge fan of vitamin D because of the research behind it as far as diabetes, colon cancer, and on bone density, etc., and calcium. But, tell us about vitamins. What do we need to know? Are they real? All this negative publicity that recently has come up about vitamins, that we're not getting what we really want. What's the scoop on this?
Yeah, well, there are two aspects to it. First of all, vitamins can provide somewhat of an insurance policy for people who have nutritional gaps. So there's a rationale for, say, more magnesium. For the vast majority of Americans who eat refined foods, they're under a lot of stress, they may literally leak magnesium from their bodies. The estimates are that maybe 80% of Americans have suboptimal levels of magnesium. And this is not the classic vitamin deficiencies that we learned about in medical school. We have beriberi, and we have rickets, and we have these terrible nutritional deficiency disorders, which are rare in America because we mostly get adequate diets. But then there's the issue of, can we optimize our performance by taking a little more? And then yet another issue is the targeted use of specific nutrients for specific conditions. And that's really what interests me in my practice, is what we term nutraceuticals, specific nutrients that can hone in on certain health issues.
So you talk about the beriberi, which is the deficiency of vitamin B1. And if you look at like the history of this, it's very interesting. This beriberi actually was discovered by Japanese sailors when they switched from brown rice to white rice. And they basically started to see what we call beriberi, and they lost a lot of vital amines. And originally the name vitamins came from that you're losing a lot of these vital amines, and then it became vitamins. Vitamin C deficiency actually led to a scurvy, which is like a lot of bleeding gums, etc., in the British sailors. And over the years, we started like replacing our vitamins, and we took care of these diseases, but then came everything else. So now you have vitamin A, E, C, you have the fat solubles, you have vitamin Bs, omega-3 fatty acid, etc. And we're not going to be able to get to all of them.